Hi everyone, Dr. K, naturopathic doctor. Today talking about acute knee injuries. So this is where you have a fall, for example, or something has hit your knee. Um, these are things that you want to consider when you're looking for pain management and treatment. So first of all, with knees, I would say, especially if it's a trauma, like you have a bad fall, um, I would definitely suggest getting it looked at as far as like getting an x-ray done and seeing if there's any breaks. So whether it be on your kneecap itself or any of the bones surrounding that, just to make sure that you're ruling that out first and foremost. And then once you've determined if there's any breaks or damage to, the meniscus or, any of the ligaments in there, then you can appropriately treat. So I recently had a patient with an acute knee trauma, and they were told to put heat on the knee for 20 minutes every hour. So from a pain standpoint, that might help, right? Just because heat or cold can be distracting from the pain that you're feeling. However, when you just throw heat on a swollen joint, what happens is even more fluid is going to pool in that joint, and part of the pain is that all this fluid is pushing on all the tissues and ligaments and everything going on in the knee. So in the short term the heat might feel good, but because it's pooling everything and actually perpetuating the swelling, it will ultimately feel worse when you take off the heat. So what I would say is heat or cold for distraction purposes, like if you're in pretty intense pain, totally respect that and get that. But once you can actually get some hot and cold going, I would say do not put it directly on the joint. And this applies to knee, this applies to ankle, especially because they don't have a lot of muscle directly on the joint that kind of helps to the blood flow to keep moving through things. Where you could get away with putting it directly on the joint is on the shoulder, because there is quite a lot of muscle around that. So what you would do with a knee or an ankle is you would actually put it above the joint. So for example, if it's a knee injury, you put it on the thigh. If it's an ankle injury, you put it on the calf, okay? And what you would do is you would do alternating hot and cold, just because joints are notorious for not having amazing blood flow. So what you want to do is pull blood flow there with the heat, right? Attract blood flow with the heat, and then push it all away with the cold. So if you have it, for example, in this case, it was a knee injury, they put it on their thigh, they put it just above the knee, put heat for 3 minutes, and then put cold for 1 minute, and alternate for 4 cycles. So that's a treatment time of 16 minutes. And what that's doing is just creating that pumping action. So pull all the blood, push it all away, and the more blood flow that's there, the more healing properties that are coming in, the faster tissue repair you have. And the reason you're using the muscle above it is that it has more blood vessels, it has more capacity for that blood to be pumping in and out. And so as a consequence, through the joint, you're having that same exact, pumping action. So heat or cold, fair enough if you need to truly distract yourself from the pain, but for actual healing, make sure that you're using the hot and the cold. 3-to-1 ratio, 3 minutes hot, 1 minute cold for 4 cycles. All right, guys, hope you enjoyed, and we'll chat soon.